Hello, my name is Igna from Indonesia. I'm one of the SSF Abortion Partnership Youth Champion. And here in Indonesia, we just established our country advocacy network. It's called YONI, Youth Network Indonesia. YONI is also part of a bigger SRHR network which focuses on safe abortion advocacy, and it's called Save All Women and Girls. Okay, so I hope you are good, you're doing well despite all of these pandemic things. And thank you ASAP for having me sharing about how is the SRHR situation in Indonesia. So talking about what is the situation for accessing safe abortion before the pandemic, actually in Indonesia the abortion is legally restricted under the health law. It means that abortion is only legal for two cases, which is the medical emergency and also rape case. But unfortunately the law is not implemented yet. So the law is there, but the implementation is still on the way, I think. So there is not yet any medical clinics or hospital is get appointed by the government, and also the mechanism is not built yet. So basically, it's still a struggle right now in Indonesia for a woman who experience unintended pregnancy to get the safe abortion. Since it's very restricted in here, it also happened that a lot of back alley abortion is there in Indonesia. I mean, like, it's so easy for you to find an online shop that sell the abortion drugs, the abortion medicine, but we don't know if it real or not. But like mostly of the medicine is not real. Like, for example, they will give you like only 2 misoprostol, which is, it will never work to terminate the pregnancy. So yeah, that is the current situation. But we did the advocacy works. We tried to doing the hearing with the Ministry of Health, and we also doing the campaign, and also in here we also have some of the hotline that will giving you the counseling on safe abortion and how to get to terminate the pregnancy safely. And on the second question, actually SRHR in general doesn't consider as an essential service. So the clinic and other medical facility, such as the hospital, is given order by the government to only focus on COVID and also other emergency health cases, which is not SRHR. So talking about the SRHR in general, like the contraception access, and also the STIs test and stuff, we have a challenge in there because the health clinic doesn't have like proper PPA. They should close their service for some times, or they shorter the time of services, and some of them stop the offline service and only giving the online, like counseling and stuff. So yeah, we could say it that it's a challenge for most of people to get the SRHR services. And up until now, there's nothing changed about the law, specifically about the abortion. Even we assume that the number of unintended pregnancy could be higher with the rising of domestic violence in this quarantine moment. It's the data is not like the statistic is not official yet, but the legal aids that focusing on women say that up until April there is a rising for the domestic violence case until 3 times higher than the usual. So with that prediction, we also assume that the number of unintended pregnancy could be higher too. And with the lockdown in many countries, it's also a barrier for delivering the medical from outside Indonesia. Like, for example, we order the contraception and ARV from India, and since India is in lockdown, it's also become a problem for the stock out for some medicine and also the contraception stock in Indonesia. And about the third question. So we see that some countries taking up progressive leaps with legalizing the telemedicine abortion. And we believe that it could be an evidence-based advocacy we bring to our government on abortion law and mechanism that here you can see like in some country they're doing this very progressive and it could be lower the risk of unsafe abortion. And during these quarantine times, which you are ordered to minimize the social interactions with other people, the telemedicine could be one of the answer. So we are planning to, from Save All Women and Girls, we are planning to giving like a statement letter, like an open letter for the government. And we demand for some things to be fulfilled, like SRHR is an essential needs, is an essential health package. So whatever the condition, the service will be there. And one of the things that we hope our government could see is the best practice from other country who legalize the telemedicine abortion during this time. And it could lower the number of risk abortion. Like the number of unsafe abortion. And also here in Indonesia, we try to submit a letter to the government. I hope when this video is released, the government already received our letter. So it's an open letter from our network. We demand the government to fulfill the basic SRHR needs because SRHR is an essential package in the Ministry of Health manual, so it should be fulfilled whatever the condition. Thank you.